Assalamu alaikum everyone. Today I'm preparing my video at early morning, and I hope and I believe that you are able to conduct your day successfully. First of all, I should provide information about our topic. Our topic is spinal cord lesion. I will try to divide this topic into the three parts, and today you will get information about the first part of our lesson. Okay, and please look at that. In this illustration, you can find out the dorsal ganglion syndrome, and the main cause of this syndrome is herpes zoster. Most of the patients who are suffering from the dorsal ganglion syndrome always go to the dermatologist according to some vesicles on their skin, okay, and some kind of painful condition. The herpes zoster located there, and when the immune system depresses, they can show their activity. Okay, the clinical signs of the patient is vesicles located the same part of the skin according to the dermatome. Okay, that's supplied by one ganglion, one spinal ganglion. Okay, and the patient can talk about the vesicles on their skin, mostly their thorax, and some kind of painful condition according to their movement. Okay, and at that kind of situation, as a neuropathologist, we should think about the herpes zoster. And it's true that as a healthcare provider, we should help the patient as treating the disease by ethically its antivirus preparates and topical dermatologic medications for using directly onto the vesicles. Okay, and the next syndrome is posterior root syndrome. Posterior root syndrome's main cause is trauma. According to the trauma, the patient can damage several adjacent roots, maybe 2 or 3 or 4 adjacent roots. According to this damage, the clinical signs can appear. Okay, and if you talk about the signs of the syndrome, loss of all sensory on the affected side. Why? Because all of the information carried to the spinal cord via posterior root. Okay, and when the lesion on the posterior root, it couldn't conduct the impulses, all of the sensory impulses. Okay, and the next clinical sign is hyperreflexia hypotonia. If we talk about our previous lessons, we provide information that all of the muscles conduct some kind of impulses from Golgi tendon organ, muscle spindles to the spinal cord, and it can cause the maintaining the tonus of our muscles. The lack of impulses to the spinal cord about the condition of the muscle. Without these impulses, we couldn't hold the muscles in some kind of positions. Okay, so these affected parts of the muscles can be flattened and hypotonia, and you couldn't watch some kind of monosynaptic or polysynaptic reflexes on the affected side. The next syndrome is posterior horn syndrome, and in the posterior horn syndrome, the damage can locate it on the posterior horn, and the clinical pictures can be quite interesting. If you learn deeply our previous lesson, you have no any difficulty. You will not have any difficulty to understand this syndrome. On the posterior horn, the impulses that are carried from the thermoreceptors and the pain receptors, not receptors, in fact, synapse with the second neuron. When the dorsal posterior horn damaged, the synapse can be impinged. Okay, according to this image, the spinal cord couldn't conduct pain and temperature information to the next neuron. According to this lesion, the patient can suffer from analgesia and thermal anesthesia. And the main cause for the syndrome is syringomyelia, or tumors of the spinal cord gray matter. Our next syndrome is anterior horn syndrome. If you learn deeply our previous lessons, I provide information about the flaccid paralysis. And the flaccid paralysis, I talked about the flaccidity of muscles. Today, we will provide information about the causes of the anterior horn syndrome. Poliomyelitis, caused by the viral infection, can cause the damage anterior horn. In the anterior horn located the alpha motor neurons, and their main function is causing the contraction of the muscle and performing some kind of activities. Okay, and when the anterior horn damaged from the cervical 7 to the cervical 8, it can cause some kind of flaccidity and the weakness of the muscles according to the innervating, according to the location of the lesion. The 7 and 8 cervical alpha motor neurons is responsible for the movement and contraction of the distal part of our upper limb. And when this anterior horn syndrome occurred at this part, it can cause the weakness and flaccidity of our proximal muscles, distal muscles. Okay, distal muscles. And later it can cause the atrophy of the muscles. In our previous lesson, I talked about that. The axonal transport that's carried by alpha motor neuron fibers can cause some kind of nutritional effect on the muscle. When the muscle contracts, it can use some kind of ATP or glucose, and it can cause the circulation of metabolism. Okay, without contracting or without any substance that's carried by the axonal transport to the muscles after 1 or 2 weeks become atrophied. Okay, all of the information is all for our today's lesson. I hope and I believe that all of the information will be beneficial for you. See you next time. Take care of yourself.